Hello guys, hope you are all okay. You are enjoying your life. You are also enjoying my videos. I'm Dr. Arshad Nadeem Awan with my ultrasound teaching videos. Welcome. And again, today my topic of discussion is postmenopausal bleeding and postmenopausal endometrium. Normally, postmenopausal patients has been given estrogenic therapy, which is called as exogenous hormone or HRT, hormonal replacement therapy. These are all exogenous hormone. Exogenous hormones are of two types, which we use for the postmenopausal period. The one is unopposed estrogen. Unopposed estrogen is the estrogen which is particularly estrogen, there is no progesterone added. And the hallmark of unopposed estrogen is it is prone to develop the endometrial hyperplasia and endometrial cancer. The second thing is called as sequential estrogen. Sequential estrogen are the estrogen which include progesterone with. Those who are taking sequential estrogen, they are experiencing a normal periods. So the purpose of these exogenous hormone is to alleviate the osteoporosis symptoms and to alleviate the postmenopausal symptoms. So these two are the reason behind giving these exogenous hormone. Mind you that all these exogenous hormone or HRT having some contraindication, including embolism, stroke, cardiac abnormality, breast cancer. So therefore we do not use that for the long term. These would be used for a short period of time to help the patient to alleviate the postmenopausal symptoms and also to help the osteoporosis process. Beside this, how we can appreciate that on the ultrasound imaging. Mind you, those who are taking unopposed estrogen, only estrogen, there is no progesterone included, their endometrium will appear thin. It will be less than 3 millimeter. So that is the sign on the ultrasound imaging that that lady is on HRT, which is unopposed estrogen, and the endometrium will never get enlarged or extend or proliferate more than 3 millimeter. If it does, it means there is pathological process going on. Besides it, those who are on sequential therapy, sequential estrogen, they will be experiencing a normal periods and their endometrium would be very as per the normal ladies endometriums going through. Like proliferative phase would be having its own proliferative thickening, secretory phase will be having its own secretory thickening, and in the menstrual phase you will see only the functionalis layer will be left and the basalis layer will be left and the functionalis layer will shed off. So this is the changes. These both are the changes and the differentiation between the unopposed estrogen and the sequential hormone therapy. But mind you, again I would mention here, on the ultrasound you pay attention to the endometrial thickening. Beside this, all these exogenous hormone therapy are prone to the risk of developing thromboembolism, stroke, cardiac arrest, and breast cancer. With respect to postmenopausal endometrium and postmenopausal bleeding, the another worth noting point is tamoxifen. Those who have already breast cancer and on estrogenic therapy, because tamoxifen contain estrogenic, so that's for again it will affect the endometrium, and especially you have to monitor the endometrium those who are taking tamoxifen. Tamoxifen changes appear as hyperplasia of the endometrium. It will look like a polyp, and it will also appear as a cystic hyperplastic changes. So always ask for the history if the patient is on tamoxifen, so you can come across all these changes. And again I would say here, these all changes are prone to the endometrial cancer and endometrial abnormality, malignant potential. So therefore pay attention, those who are taking tamoxifen, endometrium should be carefully analyzed. Look for if the patient is on unopposed estrogen, so endometrium should have been less than 3 millimeter. Those who are taking a sequential hormone, their endometrium will respond as the responses of the normal menstrual ladies are. So these are the few points which you can appreciate, you have to keep in your mind. Basically, you have to look for the unopposed estrogen therapy, sequential hormonal therapy, or tamoxifen. These three are the important points, and as I mentioned you, related to these 3 points, what would be the endometrium changes. So keep these all changes in view, take the history of the patient, then start watching the images. I have put some of the images in front of you. Hopefully these images will help you to understand all these processes. So let's start watching these videos. This is a transvaginal scan, and on this transvaginal scan, postmenopausal uterus has been shown. If you just look and concentrate on the myometrium, myometrium is slightly heterogeneous because of the senile changes. If you concentrate on the endometrial cavity and endometrial lining, this endometrium lining is between 0.1 millimeter to 0.2 millimeter. So normal criteria for the postmenopausal endometrial thickening is it should have been from 3 millimeter to 5 millimeter. It should never been increased more than 5 millimeter. More than 5 millimeter is considered to be an abnormal, and for that abnormality you have to look for further imaging and other gynecological measurement. So this is an example of postmenopausal uterus with normal endometrial lining. So endometrial thickening is not there. Breast cancer is very common in all ages, but especially in postmenopausal it is very common. So the drug which is used for the breast cancer treatment is tamoxifen. The one who's taking tamoxifen, there is likely chance of getting endometrial hyperplasia, endometrial polyps, and endometrial cancer. So therefore, those who are taking tamoxifen is always on surveillance scan. So on the surveillance scan, you should have to look for the stability and thinning of the endometrium. If endometrium is getting enlarged, it means it's getting abnormal. Tamoxifen related changes are usually hyperplasia and cystic hyperplasia. In this scan, you can see this patient having a small cystic area within the endometrium. This is actually hyperplasia, and this is considered to be a cystic hyperplasia secondary to tamoxifen treatment. So this tamoxifen treatment causing hyperplasia, many a time it causes large polyps, and in few cases it is also documented that those who are taking tamoxifen, their endometrium has gone through carcinomatous changes. This is another slide. This is transvaginal slide, and on transvaginal image you can see enlarged distended uterus. Within the uterus there is a big polyp, large polyp secondary to tamoxifen. This patient has already diagnosed as breast cancer. She is on the treatment of tamoxifen, and she was on the surveillance scan. On the surveillance scan it was picked that there was a large polyps growing within the endometrial cavity with cystic degenerative changes with central hyperplastic changes. As I mentioned earlier, there is 2 to 3 possibilities. Those who are taking tamoxifen may likely develop endometrial hyperplasia with cystic changes, or there may be a large polyp with central cystic changes, which you can see on that scan, and there is also possibility of developing cancer. So therefore those who are taking tamoxifen for their breast cancer treatment should always been through transvaginal scan for the endometrial assessment. On the endometrial assessment you should have to look for the normal endometrial pattern. In postmenopausal patient, in postmenopausal ladies, it should not be increased more than 5 millimeter. If it is increased more than 5 millimeter, it should be considered as suspicious and further imaging should be required. Here again, just for your understanding, this is a transvaginal scan, and on the transvaginal scan uterus can be seen. Its myometrium is slightly heterogeneous because of senile changes. So far its endometrium is concerned, it is 1.2 millimeter thin. So this is thin endometrium in postmenopausal women. The postmenopausal cases, you will see if the endometrium thickening, again I would say, is in between 3 to 5 millimeter, that is considered to be normal. So this is a classical case of postmenopausal uterus with thin endometrium. For better understanding, this slide is shown here. It's again transvaginal scan. Uterus is retroverted. Patient is postmenopausal. Uterus is labeled as uterus. Cervix is also labeled there, but thickened endometrium can be seen. This endometrium is thick. This endometrium is echogenic and there is no internal cystic degenerative changes. So there are possibility of hyperplasia, there is possibility of polyp development, and there is possibility of cancer. The one important thing is, whenever you come across thick endometrium, always put Doppler signal on it if there is any vascularity. Look for vascularity always, because increased vascularity, it gives rise to a suspicion of cancer or malignant potential. This is the patient, postmenopausal patient with thick endometrium. So what you have to do in this case, you have to refer this case for the gynecology department. The best is that she should be having their MRI scan, and the most on the top important investigation is dilatation and curettage, to take the biopsy and send it for histopathology. This is another example of thick endometrium, but here you can see that endometrium is not much thicker. Although it is more than 5 millimeter, it should be 11 to 12 millimeter, but so far the echogenicity is concerned, yet it is not very much echogenic, as in the previous scan you have seen that endometrium was highly echogenic. Highly echogenic endometrium is usually prone to hyperplasia and polyps, but so far the hypoechoic endometrial thickening is concerned, there is likely chance of developing of cancer. So therefore, if echogenicity of the endometrium, thick endometrium, is reduced, there may be some malignant potential is going on, or there may be some edematous changes within it, because endometrial glands gets edematous because of the secondary inflammatory changes. So whatever the case you come across, whether thick echogenic endometrium or thick hypoechoic endometrium, you always refer the patient to the gynecology department for further workup, and the next modality should be FNAC or biopsy to confirm whether there is any malignant potential or not. Here on this scan, it is significantly enlarged, significantly thick endometrium, and the patient is in postmenopausal status, and myometrium is still heterogeneous because of senile degenerative changes, and endometrium is quite thick. This endometrium is 4 to 5 centimeters, so it's mean this is significantly thick endometrium, and it should have been dealt with care, with great care. So the best method is mention on the report that the patient is showing postmenopausal endometrial thickening up to 5 centimeter. There is no vascularity, or there is vascularity on the Doppler imaging. Further imaging should be required, immediate required, to find out any malignant potential. So the next modality should be MRI. Ever advise MRI, pelvis MRI, to look in a better fashion whether endometrial changes, still there is any growth within the endometrium or not, and also advise DNC for histopathological purpose. Postmenopausal bleeding is related to endometrial thickening and endometrial thinning. Normally in postmenopausal changes, the endometrium happens to be very thin, atrophic endometrium. Many studies shows it should be 2 mm, 3 mm, and many advocate for the less than 5 millimeter. So less than 5 millimeter would be considered as normal and atrophic endometrium. Many a time you may see some small cystic changes within the thin endometrium, that would be called as cystic atrophy. Still it's normal. Thin endometrium with the vaginal bleeding in postmenopausal women would be considered as normal, because endometrium is thin. But if this endometrium is thick, so then the suspicion should be raised and it would be considered as malignant, and further work up should be needed. So therefore, pay attention in postmenopausal women. I have discussed all these images with you, and I have shown you different types of the endometrium thinning and thickening, and with cystic changes and changes with the tamoxifen. All these has already been discussed. I'm sure that this video will definitely help you out in understanding the postmenopausal endometrium. And the patient who's complaining of postmenopausal bleeding, you must be paying attention, extra cautions for picking all these points. Always look for the transvaginal scan, because on transabdominal scan sometimes you cannot pick clearly, but if bladder is fully distended, you can pick some point and you can write your report. But if in case of any doubt, always go for the transvaginal scan, so that you can easily pick all these information, especially those who are on unopposed estrogen therapy or any exogenous hormone or HRT replacement. I'm sure this video will help you out. If related to this you have got any question, get back to me, drop me a message. I will try to explain it in a better way, but I do hope I have clarified all of the information, all of the problems on this video. Keep watching my video, keep sharing my video, and with next video we'll see each other. Till then, take great care of yourself. Bye bye.